There is a procedure called vertebroplasty. This is what we call a pinhole operation. So pinhole operation is a much superior operation to a keyhole operation. So in a keyhole operation, what we do is we make a small opening and do the operation. Whereas in pinhole surgery, we don't even make that small cut. So we just pass a needle into the diseased area and do the procedure. So these procedures are known as pinhole operation. There is not even a cut in the skin. So where do we do this pinhole operation? What we call one of the pinhole procedures is known as vertebroplasty, and this vertebroplasty is done in different types of conditions. The most common condition in which we do this procedure is known as an osteoporotic vertebral compression fracture, and this can also be done, this vertebroplasty procedure can also be done in some benign bone tumors like hemangiomas, some of the other malignant bone tumors, whether the cancer has spread to the bones in the spine, or if there is a primary cancer of the spinal bones, like if there is a cancer called multiple myeloma. So this vertebroplasty can be done. So vertebroplasty is primarily done for osteoporotic compression fractures and then benign bone tumors like hemangiomas or malignant bone tumors to reduce the pain. So of the three conditions which I enumerated, the most common condition we see in our day-to-day practice is this osteoporotic vertebral compression fracture. So if you look at what exactly is this osteoporosis means, so there is a substantial loss of calcium from the bones. As a result, the bones become weak, and even a trivial injury, a small injury, can cause fractures of the bone. So this is what is known as osteoporosis, and this osteoporosis is most commonly seen in the elderly people, especially women above the age of 55 and 60 years. So these elderly women, even a trivial fall in the bathroom, a small slip in the bathroom can cause fractures of the spine. And I have seen elderly women traveling in a bus, even the jerks in the bus can cause fractures of the spine. So that's these fractures happening in the spine because of osteoporosis, what we call osteoporotic vertebral compression fractures. And these patients have severe pain, unbearable pain. They have difficulty in rolling in the bed. They have difficulty in turning in the bed, and they have difficulty in getting up from the sitting position. So previously, what people used to do to treat these osteoporotic vertebral compression fractures is they used to offer bed rest to these patients, painkillers, and a lot of supporting braces. You must have seen people wearing the belts and braces. So the bed rest, medicines, and the braces. So but the problem with bed rest is 1 day of bed rest takes away 1% of the bony calcium. Say if you offer the patient bed rest for a period of 30 days, so 30% of bony calcium will be lost because of bed rest. So already these patients have very low calcium levels in the bones, and if you offer bed rest to these patients, they lose further calcium from the bones and they become very weak. So the very idea of doing any procedure in these patients is to mobilize them as quickly as possible. The second thing is to reduce the pain, we give anyway painkillers. And third thing is they give a lot of belts and braces. There is no research support to say these belts or the braces help these patients with osteoporotic vertebral compression fractures. So this was the way how we used to treat these patients before: bed rest, medicines, and the belts. But this is a procedure, vertebroplasty is a procedure which can be done these patients. So if you look at what exactly is vertebroplasty, so we pass a needle into the fractured bone percutaneously. Percutaneously means without cutting anything, we pass a needle under a machine. That machine is called image intensifier. So that guides us where exactly are we with the needle, and we can accurately pass this needle with the help of that image intensifier into the fractured bone. So once this needle is in the bone, we inject what is known as bone cement. This is also known as methyl methacrylate. It is actually a liquid in form outside. So once we inject, it goes into the bone, solidifies, becomes very hard, and supports the fractured bone. This is done under local anesthesia, not with general anesthesia, with local anesthesia, with a little bit of sedation to the patient. The moment we inject bone cement into the bone, the pain comes down instantaneously. That means they get tremendous pain relief, and there is no need to no need to take any bed rest once we do this procedure. And this is what we call a daycare procedure. That means patients get admitted in the morning, we do the procedure, patients go home in the evening. It's a very simple pinhole operation, passing the needle, injecting the cement, and the patients get good pain relief. But the flip side to this procedure, that means the disadvantages of this procedure, there are a couple of disadvantages. One is it has to be done by a trained spine surgeon who can do these procedures effectively, because if you are not really trained and if you try to inject bone cement, this bone cement can leak into the surrounding areas. It can leak into the spinal canal and press on the nerves and can cause damage to the nerves. So you have to be really experienced in doing this vertebroplasty, that is injecting the cement, so that you avoid a lot of complications associated with inexperience. That is one important complication with vertebroplasty. The other important thing which happens with vertebroplasty is, in osteoporotic compression fractures, the height of the bone comes down. Normally it is a square shaped one, so it's kind of, once it is compressed, it becomes a wedge shaped bone. So if with the cement injection, the height of the bone is not restored, the height of the bone will be collapsed only, but the pain will come down, patient can be mobile immediately. So this is another disadvantage with vertebroplasty. To obviate this disadvantage of vertebroplasty, there is a newer technique called kyphoplasty, wherein we pass a needle into the bone, and through the needle we pass a balloon, and once the balloon is inside, we inflate the balloon. So as we inflate the balloon, the collapsed bone almost comes to normal shape. So once we are happy with the shape of the bone, we deflate the balloon, take out the balloon, then we inject bone cement. So that is the advantage of kyphoplasty. So advantage of kyphoplasty is it restores the normal height of the vertebral body, the bone, and the leakage rates. So I spoke about the leakage rates in vertebroplasty. The bone cement leakage rates are very low in kyphoplasty. So these are the twin procedures, what we call pinhole procedures, twin procedures of vertebroplasty and kyphoplasty. And these are the procedures which we do in osteoporotic vertebral compression fractures, and these are the elderly people, and once the pain comes down, we mobilize them very quickly without any braces, and most of these patients get back to work very quickly. And the other important thing one has to remember while treating these osteoporotic vertebral compression fractures is after doing the procedure vertebroplasty, my duty is not over, because I treated only one bone, but the rest of the bones, they are deficient in calcium. So I have to treat the patient comprehensively to improve the calcium levels. So one has to look at this treatment of osteoporosis. I see a lot of patients saying that I have taken calcium tablets for about 2 months, 3 months, and then they assume that they are completely protected from this osteoporosis. It's not true. So you have to take calcium tablets. Along with the calcium tablets, there's a group of medicines called bisphosphonates, and these bisphosphonates have to be taken for a period of at least 3 to 5 years. After a period of 3 to 5 years, we give what is known as a treatment holiday, and after treatment holiday we restart the patients again with bisphosphonates. So apart from treating that fractured bone, we have to comprehensively treat the patient for osteoporosis, and this osteoporosis treatment not only includes taking calcium tablets, it also includes taking other group of medicines called bisphosphonates, and they have to be taken for a longer period of time, for at least a minimum period of 3 to 5 years. So with this, the patients get good pain relief, and the possibility of the second fracture will come down.